So there you go. All right, the deadline is approaching to sign up for health insurance, or is it? Americans have until the end of the month to enroll in health insurance plans or pay a penalty. Or do they? Most people without insurance don't even know the deadline. According to a Kaiser Family Foundation tracking poll, 6 in 10 uninsured adults are not even aware excuse me, that open enrollment ends on March the 31st. Not really. Half of the uninsured surveyed said that they will remain without coverage this year. All right, what were all those not reallys and kind ofs and sort ofs? Well, let's get our insurance expert, Craig Gussin, in here this morning. Craig, the administration has already, they kept saying there will be no extensions, there will be no extensions. Now there's an extension, correct?
Right. There's an extension, and from what I read yesterday is if you made an attempt to submit an application prior to March 30th or prior to April 1st, you're going to have to April 15th to get it done.
Yeah, but the goofy thing about this is it's totally on the honor system.
Right.
So it's anybody can go sign up now that hasn't signed up yet. Exactly. They can sign in and continue to work on this process.
Right.
Is there any deadline out there, a firm deadline that you're aware of? Is there some date that we should be telling people right now, do this by this time or else?
April 15th.
Okay. Well, that's tax day.
That's tax day.
So you should file your taxes by that day. But health insurance?
Done.
You really think so?
Yeah.
You think this is a... Why would this deadline be good when none of... There's been 38 deadline extensions so far of all the various things.
So a couple things. If you want health insurance as of April 1st, you're going to only be able to go to Covered California to get it. You can't go to any of the insurance companies directly as you can today. So unless they change that, and I don't expect that. But I've been told for a while that it's going to be April 15th. This is not really news to me because it's been out there in the insurance world that we pretty much knew they were going to delay it.
Well, then why did the administration keep coming out saying we're not going to have any extensions? Can you believe anything the administration says about health insurance?
They did not want people to wait to the last minute. That's what we were told.
So they lied.
Well, they were not being very truthful.
You know what? I think we've got to stop.
I know.
We've got to stop dancing around this and call a lie a lie. When people look us straight in the eye and say there's not going to be an extension, this is the deadline, and then you're saying, well, you know, we knew, but they wouldn't let us tell anybody.
Yeah. So they want the numbers, and I sort of understand it to a point, but I agree with you. You have to basically say, okay, this is it. Now, I've been talking to people recently that I thought knew this stuff, and they still don't get that you can't buy health insurance as of April 1st. They just assume you can't go to Covered California. So just what you said a couple minutes ago, people don't realize that as of April 1st, nobody in America can buy health insurance unless you, quote, submit an application and didn't get it done yet.
Now, we're still talking about, in the big scheme of things, though, a relatively small number of people, correct? How many people are uninsured are we looking to try to get insured?
I think how many people are in California, and we got, what, 1 million people signed up? I mean, I think there's probably a lot of people that aren't signed up, because we figure, I'm trying to remember, I don't remember how many million people are in California, but I think at the end of the day, you're still going to see a lot of uninsured people. When we started this whole process 5 years ago, there were about 15% to 16% of the people uninsured. At the end of the day, what are we going to be at? And I'm guessing 12 to 14% uninsured.
So maybe we picked up 3% through this whole process.
And it's probably and it's probably all people who are on Medi-Cal and they're getting it for free. So
we're not really, this hasn't impacted except to make the process more expensive and more complicated.
Exactly.
Okay, that's not my assessment. I'm just reaffirming, you know, the expert opinion.
Yeah,
all right, let's get an email question here from somebody. I received a Covered California letter only giving me 90 days of health insurance coverage. Why is that? That's from Tracy in Eastlake.
That is going on a lot, and the reason is because they want it. You need proof of residency. A driver's license works fine, or you need tax documentation. So what we normally get is page 1 and 2 of your tax return. We send it in, they upload it, and that'll take care of it.
Okay, I need help signing up. How do I even start? That's Seth and Ramona.
The best way, Seth, would be to contact an agent. You can go directly to Covered California, go online and put your information. But if you contact an agent, we can walk you through the whole process from beginning to end and get it all done.
I love this one from Carrie in National City.
Yeah.
I have insurance, I think. How do I pay for it?
That's a funny one because we get that question a lot. So what I'm going to be doing is when I get back to the office, I'm going to email Channel 6 an outline of every insurance company and what you need. So basically what you need to do is contact them. I'll give you a couple different ways to do it. You need either your case number if you have it, but you need, or your Social Security number. You can go online and pay it. It's very, very common right now that you get an approval and you don't get a bill yet, or you're waiting for your ID card. This is an ongoing situation, but it's purely because everybody is waiting to the last minute. And that's why I just beg people, do not wait until Monday. If Monday is anything like it was on the December deadline, I'll be working till midnight.
I don't want to sound like the total pessimist here, but at some point we've got to face the reality of this. 38 extensions that we can think of so far, which we don't even know if that's legal. The law was supposed to be the law, and then suddenly they just start changing it.
Yes.
Is there anything about this that has been improved, or we just keep putting delays out there?
The thing that's been improved is that anybody can get health insurance. So when I have somebody come to me, maybe a woman who's pregnant or somebody with diabetes or has some cancer issues, I can get them health insurance.
Okay.
People who can't afford it can either get a subsidy, which is going to help some people, or they can go to Medicare and they can get coverage. But for the rest of the people, they're spending a lot more money for coverage they probably don't want or don't need. So at the end of the day, there are some improvements. I'm hoping in 2014, by the time 2015 comes, they've made changes to make it better. But right now, it's still a mess, and it's going to be a mess for another 30, 45 days. Just take a breath, relax, and work with your agent to help you get it taken care of and fixed. And as long as you're covered by, you have your coverage in place or your application in place by, sometime next week, you should be in good shape.
All right, Craig Gusson, we'll talk to you next week and see how things are going. Thanks for coming in.